Hi, and welcome to our little video about an orientation on your admissions. First of all, I'd like to say congratulations on your admissions into this very prestigious program. What a privilege it is to be a part of it, and I hope you feel the same way too. I'm here today to talk a little bit about some of the admission requirements, things that are mandatory for you upon admissions to the program. The first one is to get the book and read it, called Make It Stick. Now this book you can find in a library, you can find on Amazon, you can find in a bookstore, you can find online in other places, but you need to have this book read before our first orientation on Thursday of the first week of classes. Which brings me to my second admissions requirement, orientation. We will have an orientation dinner during the first week, and the information about that will be found in your admission packets, which you will be receiving shortly. The other orientations are for the first term. They're every Thursday at 11 a.m. Again, information about your orientations will be in the packet that you will be receiving shortly. So pay attention to what's in that packet. But the main thing I want to focus on today is the third requirement, which is of course the admission packet. What I'm going to focus on in the packet is your immunization page. Now, when you flip through it, you'll see all these different page colors, okay? I'm going to start with the tan page, okay? It's called Important Information About Immunizations. So if you have your packet already, as you're watching this, then hit pause and go ahead and find the page. If you don't have your packet yet, then you may want to re-watch this video when you do have your packet so you can follow along with me, okay? So, important information about immunizations. These two pages. These two pages we recommend that you keep throughout your time at nursing because it will apply to you throughout your nursing program for the next 3 years. So you need to be able to reference them. Immunizations are required for you to be able to do clinicals. Now clinicals we have to set up the semester before you start. Since you start in your second semester in clinical, we need to set all of the information up, the paperwork, and the immunizations the semester before, which is of course your first semester in the program. So this is important that you get this done right away. There is a deadline on this, by the way, which will be in your packet. So make sure you read that thoroughly. I'm going to start out on the second page actually, because we're going to start with the easiest immunizations and work our way to the hardest ones to understand. Sometimes immunizations can be confusing. So if you ever have a question, or if you think your doctor says one thing and the page that we give you says another, please call us because this is what our hospitals require. So you must pay attention to this page, and if your healthcare provider is saying, oh, you don't need that, don't listen to them, okay? Do it according to what the page says. So it's important that you read this page instead of just hand it to your healthcare provider because they never read it. Okay, so it's important you know what it is and that you speak up if they say something different, okay? So first we're going to talk about your CPR. Now it's a very specific type of CPR that you have to get. It's from the American Heart Association. It's a 2-year certification. So since the program's 3, you're going to need to get it recertified at some point in the program. Now we do offer this as part of our Student Nurses Association, or SNA. But you can also do it on your own through any American Heart Association chapter, which would be in any city in any state in the U.S. So if you're not here in Utah at the time of receiving your packet, that's okay. You can either wait to do it for SNA or someplace else on campus, or you can do it at your home state. It doesn't matter. But you need to get a very specific CPR certification. So please read that to know which one you should get. It's called Basic Life Support for Healthcare Provider. The next thing that we need are chickenpox. Some of you probably already have your shots or have had the chickenpox. What we need from you is either a titer, which is a blood draw. So they have to take your blood, they test it to make sure that you have the immunity to chickenpox, or you need to have 2 chickenpox shots, okay? It's one or the other. Just showing that you had chickenpox as a kid isn't going to cut it for our facilities. So please, 2 shots or a titer. The next is the flu. Now, the flu is only given once a year, and it's actually only given every September. So if you are admitted to the program for fall, you'll get the flu shot this September. If you're admitted for winter, you wait a semester before you get your flu shot in September. Does that make sense? If you have questions, just ask us. But basically, you get it every September. Next is polio, or OPV or IPV, it's also called that. This you should have had as a child, and it's so just a record of the shots that you had as a child will be fine. The next one on the list is called a Tdap. Okay, this might be a little confusing because as a child you would have gotten the Tdap, but that's the child dosage. You need the adult dosage, which is a Tdap. It's called tetanus, diphtheria, pertussis. Okay, make sure that you have the right adult dosage of the Tdap. That will expire every 10 years. So if you had that as a teenager, it may expire when you're in the program. If you get it now, then you're good for the rest of the program. Now let's go to the first page of the immunizations, okay? Because this has kind of some of the harder immunizations on it. First off, we're going to start with measles, mumps, and rubella, the MMR. You should have had 2 shots of this when you were a child, and we need records of those 2 shots. If not, you can get titers drawn. Again, titer is a blood draw, right? You're going to get titers drawn to show that you are in fact immune to the measles, mumps, and rubella. Okay, so this one is a little bit tricky. The next one is a TB, tuberculosis shot. We actually need a 2-step TB. Now let me explain what a 2-step TB is, because oftentimes people don't understand this. This is coming straight from our hospital and clinical facilities, so this is exactly what we need from you is what is on this page. So again, you must make sure that your healthcare provider does it the way it's said on the page, which basically means this. You get the TB shot twice, okay? That means you're back 4 times to the doctor. 1 time to get the shot, then you have to wait 48 to 72 hours, go back and have the shot read. After you've done that first shot, you have to wait 7 to 21 days before you can get the second shot. Okay, if you go past 21 days, you have to start over. So get the first shot, wait your 48 to 72 hours to have it read, and then wait 7 more days. This is the best way to do it. And get another shot. You'll go back and get the shot, wait 48 to 72 hours, and go back and get it read. That means when you turn in your documentation of your 2-step TB, we should have 4 dates on there. The first date placed and the first date read, the second date placed and the second date read. Then we'll also need the results. Hopefully they say negative, right? Or 0 millimeters. Either way would be fine. That's exactly what we need for the 2-step TB though. Now the last one, which is actually the first one listed on our important immunizations page, is probably one of the hardest ones to understand. This can be a little technical, so even after my explanation of it, if you want further explanation, please call us and we're happy to explain it. This is the Hep B information. Now we need your 3-shot series records, so your first shot, your second shot, your third shot, as well as a titer. So that's again a blood draw. So the first shot, and this is detailed on here, I'm going to read it off of the page, but again I want you to make sure you understand this when you go to your healthcare provider. So you have your first shot, then you have to have at least 4 weeks between the first and the second shot, and then at least 8 weeks between the second and the third shot, and at least 6 months between the first shot and the third shot. Now most of you had this as a child and it was done correctly and you don't have to worry. However, if you did have it as a child, chances are high that you had the child dosage and not the adult dosage. So before you get your titer, you may want to consider having a 4th booster shot of the adult dosage before you test for your titer. What we found, and you don't have to do this, but what we found is that most students come in with the child dosage and are testing negative, as in not immune, on their titers. And they have to go and get a booster shot anyway and then go back and get another titer. So if you want to try to just avoid that from the beginning, I would recommend that you get a 4th shot, your booster shot first. After any booster shot, you do have to wait at least 1 month before you can get your titer drawn. So you have your first 3 shots. Let's say you go get your 4th shot. You wait a month. You have your titer drawn. If your titer comes back showing that you are immune, you are good to go and everything's great. If your titer comes back showing you are not immune, you need to immediately get another booster shot. Okay, wait another month and have another titer. I hope that makes sense. If it doesn't, please contact us. Now, some of the immunizations, some of you on a rare occasion cannot get because you're allergic to the shot, or maybe you're pregnant. If there's any medical reason why you cannot have an immunization, then you need to provide us with a doctor's note explaining that. That should be on a doctor's stationery with his signature and his name printed, okay? And that's what you would have to do to turn it in, and we'll go from there. If you have any questions, or if you're in a waiting period, sometimes if you try to get all the shots at once, you can't because they conflict with each other. And so you may have to get 1 shot and then wait a bit before you get another. That's why you need to start the immunization process as soon as possible. Sometimes it takes a while to get through the whole thing. Okay, now that we've learned about all 3 admission requirements, just to recap: reading, make it stick, number 1. Number 2, attending the mandatory orientation times. And number 3, your acceptance package, which includes your immunizations. If you are unable or unwilling to complete all 3 requirements at their deadlines, then we ask you to mark "I do not plan on attending the nursing program" on the pink sheet found in your packet, because you won't be able to attend without those requirements.
If you have any questions, please feel free to either give us a call at 801-422-4173 or email us at nursing_advisement@byu.edu, or simply come in, have a seat, have some candy, and we would be happy to discuss anything that you would like to discuss. Thank you for watching. We look forward to meeting you and getting to know you better. And again, congratulations on your acceptance into the College of Nursing. Have a great day.